A recent investigation of Dammisch State Hospital has revealed a series of problems related to patient discharges. Poor record keeping and a number of lost patients were disclosed, and that in the face of a statewide plan to move mental patients out of the hospitals and into the communities has officials concerned. Randy Ripplinger reports in this segment of his special series how the state and the mentally ill are trying to cope with a plan that is perhaps the last resort.
Crazy John, where you gonna run to today?
Usually once they release you from the hospital, unless you have some good connection somewhere, you're left on your own.
Crazy John, so early to be up and away.
The hospital does not have the facilities to stay involved with the patient.
So how can you teach them?
They didn't have programs out in the community, didn't care. Once they were released, it was somebody else's problem.
So how can you reach them?
But the follow-up is the responsibility of the mental health program in the community.
Crazy John, you tell them what they don't want to know.
Grossly underfunded for doing the kinds of things that we know need to be done.
Money alone is not the problem.
Talking with the desperate man, you have to be crazy John.
If the legislature offered you another $5 million, would you turn it down?
Not a bit.
Crazy John, I want to be crazy.
It is reduced at times to weighing dollars against human suffering. And while Dammisch and other mental hospitals carefully regulate a patient's life inside the institution, sometimes they do too little to pave the way for his transition into society again, where the stresses of everyday life will test his confidence and ability to cope. Indeed, life in Dammisch can be leisurely. There are opportunities for arts and crafts and some degree of occupational therapy. But decisions here don't approach the frustrations encountered on the outside. Even the patient's diet is determined for him to an extent.
We're having turkey today. Turkey, asparagus, and...
But Dammisch itself is undergoing some stresses. It is losing $1.5 million, 57 staff members, and about 1/4 of its patients by July of this year. It's called the Bed Reduction Plan, all part of a process to move people out of the hospital and into the community. Not only the patients, but the hospital's dollars are making it out to the communities to help house and counsel the partially cured mentally ill. It all came about because a legislative task force didn't like the way it saw the mentally ill being dumped in urban squalor with no help from the community.
When they get their bus pass and a couple of dollars for a hotel usually and go back to the community, they usually lost. And we have now said enough of that. That can no longer happen to probably the most unfortunate population that we have in the state.
We do a lot to help him in that initial process of making the transition to the community programs.
Dammisch officials arranged for us to film a patient going through discharge planning. A conscientious counselor will see that the patient has a place to stay, medicine, an appointment with a county outpatient clinic, and some source of money.
Okay, because with the assistance, we're going to be working with like $195 a month, plus some food stamps and a medical card. But essentially, the $195 is going to have to cover everything in terms of getting in costs. Okay?
But as we reported yesterday, there are examples of the program failing. Medicine is mishandled by landlords, patients receive little or no contact from a counselor, and they are subjected to filth and abuse at times, all of which deteriorates his mental health and often forces a return to the hospital. The blame is often laid on the county's shoulders.
What we want to do is to make some staff available to work with people in their natural environment. If they're living in a cheap hotel, that cheap hotel may not be a bad place if we can help to make it a better place to live.
Do you?
We don't do much now because we haven't got the staff.
In fairness to the Multnomah County Mental Health Department, it has borne the bulk of the problem in Oregon. In the past, Multnomah County has received 20% of the state funds available for helping mental patients, but 40% of Oregon's mentally ill live here. At least when some money was moved from Damish to the counties this year, Multnomah County got a bigger share this time. The county is starting to develop some centers to watch after its outpatients now. The trouble is the mentally ill hit the streets before the money did.
I'm saying that you close a ward in Damish and then you tell the community to keep them out in the community. It can't be done at the level it was funded at.
We wouldn't do that if we weren't pretty sure community support units were working. My first impression is they indeed are working.
The fact of the matter is community support is not in place to the degree state mental health officials expected. When we in the Mental Health Association of Oregon reported the resulting problems to Dr. Bray, he initiated an investigation here at Damish of their discharge procedures. After reviewing 100 cases spread over 5 months, Bray said one of the most disturbing problems was the lack of record keeping here. Often when a patient was discharged, the records did not reflect what preparations were made for his re-entry into the community. Even the details of where the patient was to be living were either ignored or not recorded. The survey of the records showed these figures. 22% had group or foster homes to live in. 24% had semi-independent or board and room arrangements. 1% chose hotels. But in 53% of the files, the type of housing was not specified or there was no record of where the patient went. So while the system is moving patients out of the institution, in many cases they are left in poor living arrangements with inadequate community resources to prevent a return to the hospital. But if the system does not work this time, there is still another last resort.
We think it's a viable concept. There's risk involved. There is a mechanism built so that we can retreat from it and put the money back in the hospitals.
I have to somehow sit back and hope that what we've created in the legislature with the help of the state and the counties will be successful. That's the only way some of us can keep going. If we don't, then, you know, you give up. I hope we won't be too disappointed.
Crazy John, where you gonna run to today? Crazy.
Some will run into downtown Portland with its cheap hotels and boarding houses. And it's there where some mental patients may fall into the hands of those who could take advantage of them.
Crazy John, can I come along when you go?
Tomorrow we'll take you on an undercover tour of illegally run housing for the mentally ill. Randy Ripplinger reporting, Channel 2 News.